I'm Professor Rowan Pritchard-Jones. I'm a plastic reconstructive surgeon by background and moving from being the medical director at St Helens and Knowsley Trust to being the medical director for the Cheshire and Merseyside ICS.
My name's Fiona Lemmon. I'm a GP. I've been a GP in Liverpool for 25 years and I am the new Associate Medical Director for the Cheshire and Merseyside Integrated Care System. In this role, I will still be a practicing GP, so I'll still share all the clinical responsibilities and all the pressures and challenges that everybody else in the system does, so that I will still understand what's going on out there at the front line. But in addition to that, the medical directorate role will include thinking about how we reduce health inequalities, how we improve outcomes for patients. It'll be about quality improvement and about getting better patient experience and doing all that within a budget.
Hi, my name's Marie Boles and I'm currently the Director of Nursing and Care in Cheshire and Mersey. I've been a nurse for 38 years and I've particularly worked in Cheshire and Mersey for the last 2.5 years. So in my role as the nurse to the ICB board, I guess I have a lead responsibility in terms of patient experience, patient care and all the quality dynamics that we need to think about both in health and in social care. And it's a really exciting opportunity that this role actually spans across health and care, which is really a fantastic opportunity to bring all of those conversations together. I've had a 38-year career in nursing. I'm actually a mental health nurse by background, and I guess when I did my training all of those years ago, that a lot of the NHS was very much based on hierarchy. We had a dominant voice, I guess, in terms of medicine. But over my years in practice, really I've come to appreciate the value of multidisciplinary working. It's an opportunity just that everyone gives a fresh perspective, creating an opportunity to challenge ways of working, thinking about new ways of working. So I think what I've also seen in my career is that some of the true value around some of our other disciplines and the role that our local authority and care home staff actually play, that this is actually about trying to find out the best outcomes for individuals so that we can determine where they go on that journey and who's best be able to support them going forward.
One of the most important things for me and that gets me most excited about taking up this new role is the opportunities to tackle the really significant health inequalities that we have. I think CCGs, which we've had up until now, have just started to scratch the surface of that work. But by coming together across Cheshire and Merseyside, I think we've got an opportunity now to really make some inroads, and it's a real priority for the ICS to do that. So one of the really exciting opportunities is to work as a marmot community and to increase that work that we do across all sectors, so not just health, but across our social care partners, our housing partners, and lots of different ways. So the integrated care partnership is going to be really critical to that, and we need clinical voices in there as well.
So there's no doubt that the way we deliver both our health and social care has existed in silos up until this point. And the ICS integrated care, as it says, is that opportunity to bring all of this together now, to break down the barriers that exist. To break those barriers effectively, we need to listen to all the people that are already delivering great care within their own settings, but grasp with both hands the opportunity to deliver that differently, because we are here for every single patient and citizen to improve their outcomes.
So I think it's really important that we bring clinical and care leadership together, because we've got to join up our services better. It's what the public and patients expect from us, that we will integrate our services. In fact, they think that they're integrated and joined up already. So if we are going to properly integrate our services, we have to make sure that all of our staff at every level throughout all of those services have a voice and some influence in shaping the decisions about how those services are delivered. So one of the very positive things that I hope we'll get out of developing the clinical leadership framework is that it will help us to develop clinical and care leaders of the future. So it'll help us to connect to people at the start of their leadership journey. It'll give them opportunities to influence and learn from those of us who've been around for a little bit longer.
We know that we've got some fantastically talented care and clinical staff in Cheshire and Mersey, and this is a real opportunity to harness that enthusiasm, that passion and that commitment to make sure that we provide the best possible outcomes for people who live in Cheshire and Mersey. But staff have come through the pandemic, and that's not just in health but in care. People are exhausted, people are recalibrating in terms of whether they want to stay in the professions. So we've really got to make sure that we absolutely value the contribution that they make to develop our ICB. The majority of the clinicians, I suspect, live in Cheshire and Mersey, so it's if nothing else, the self-interest that people need to be developing services that they would like to receive themselves.
So the role of medical director is to make sure that we get the very best care for our citizens, because this is no longer just about our patients. And I know that our region is full of subject matter experts out there already delivering great care. But this is a unique opportunity to bring those voices together, make sure that that expertise is heard and listened to, acted upon, and through the leadership, we put together new ways of working, huge opportunities to shape better care for everybody in our region.
So we need clinical and care leaders from every level in the system, because it's people who are working at the front line, who have day-to-day contact with patients, that work in their communities, that really understand what the needs of that individual or that community or that population are. And we need those people to tell us at the ICS so that we make the right decisions at that ICS level about services.
But I think it's really important that it's not just people who shout the loudest or the professions who are the strongest in terms of numbers, because we actually provide some really innovative treatments and approaches and offers to people from a variety of clinical backgrounds, including the voluntary sector. And I think there's a real opportunity to think about how we can transform some of our services, not just thinking about what I call a medical model of working, that wider sort of approach and consideration on health determinants.
Yeah, so as medical leaders, it is perhaps easy to fail to recognise just how diverse our population, our citizens and our patients now are. Everything from local authorities, the voluntary sector, social prescribing, which is hugely coming through, but does it really have its voice heard and its place fully recognised and developed yet? Possibly not. Our community is amongst the most deprived in England, and it is essential that we think so carefully about how we tackle the inequities and inequalities that persist out there. This is the opportunity to really start to address that properly.
It's really important that we don't just rip up what we've already got, because there are some established forums and professional groups that we've already got. We need to harness them to support not just the peer support and development for their colleagues, but to make sure that those conversations come together.
There is actually lots of really good clinical leadership happening at place level already. So our CCGs have developed a lot of clinical leadership. It's one of the things that CCGs did give us. It's a legacy that I think we should be proud of, that lots of CCGs have developed their clinical leaders. That is predominantly doctors and nurses. So where we need to go next in place is that we need to bring in our physios, our social workers, radiographers. The whole gamut of clinical leads and specialties need to be part of this.
This leadership framework will evolve over time. And it's crucial to say that it's not simply about listening to the voices and the ideas, but it's them working together to create something that will make a real difference. And most importantly of all, reflecting that back to all that have contributed, that they know they are valued, listened to, and will want to continue contributing to the way we develop leadership within our system. What I want to see happen is that our citizens stay well. Our citizens do not need to turn into patients. That the patients we have live well, get the best care they can, and wherever possible, we don't turn them into our inpatients in hospital. And for our patients that must be in hospital, we commit to getting them back home as well as they possibly can be. Together, we will keep everybody in the best health that they can achieve.